Once again, welcome to today's Q&A session. So we have two presenters with us today. We've got Val Nicholson, who's an MDFA volunteer and lives with macular degeneration, and Victoria Heaton, who is an optometrist. So to start by introducing Val, Val was diagnosed with late-stage wet macular degeneration in 2009 and began her treatment from then. Shortly after being diagnosed, Val joined the Macular Disease Foundation Australia as a volunteer. Val's positivity, advocacy for macular disease, and her knack for never forgetting a birthday has made her an invaluable member of the team. And today, Val will be sharing her experience living with macular degeneration. Vicky, who's our other presenter for today, is a research assistant at the Macular Disease Foundation Australia, and is also a practicing optometrist. Vicky graduated from the University of New South Wales with a Bachelor of Optometry and has worked across various primary eye care environments over the last 20 years. She has a special interest in advocacy and eye care delivery for senior Australians. So welcome both Val and Vicky. So to begin, we're going to start with Val. So if you're ready to unmute yourself. No, not quite there yet. So it's the bottom left icon. You just click on the picture. There you are.
All right.
You're on.
I'm
Welcome.
on.
All right.
Hi, everyone. Thanks, Natasha. It's lovely to be here and join in the webinar.
No, it's really looking forward to the discussion. So the first question we have for you is, how did you feel when you were diagnosed? So I've known you for the past 4 years in my time at the foundation here. So I know that you were diagnosed back in 2009. So can you just tell me a little bit about that day?
I can. It was a very memorable day for me. And you asked me how did I feel? Well, strangely enough, I felt very annoyed, I felt angry, and I felt frustrated. And I can explain just a little bit of why I felt like that. Back in 2009, in September, I had been spending a lot of time caring for and helping and supporting a very dear friend who was the neighbour whose husband had been killed tragically all of a sudden in an accident, and she had 2 little children and no family in Australia. So I'd spent a lot of time being with her and helping her. And during that period, from early September, I started to see wavy lines with the grouting on our kitchen tiles, door jambs and things that should be straight felt crooked. But I didn't think it was anything greatly important. When I woke up, I could see the ceiling was pink, but then it went away. So I just put that aside and didn't do anything about it, which I now discover was a very big mistake, because it was something important, but I delayed doing anything about it. So on October the 28th, which will be a day I'll never forget, I decided to ring up the ophthalmologist and make an appointment. And usually you had to get 6 weeks notice to get an appointment. So I rang up, and the receptionist, and I explained why I needed to go. She said, "Oh, the doctor says to come straight down." And apparently I was amazed, because that doesn't usually happen. And I said, "Well, I'm sorry, I can't come. I was going off to be checked out for a form of cancer and see if I had that." And I had that appointment. And the doctor, I said, "I can't come in the morning." They said, "Oh, just a minute. No, come straight down after that appointment." And I thought, okay. So I went off and I discovered, no, I didn't have breast cancer. That was great. But I went straight to the eye ophthalmologist, whom I've been to for a long time. He gave me some tests. He said, you have wet macular degeneration. I'm referring you off to a retina specialist. You need to have an injection straight away. And I didn't know anything about macular disease, nothing at all about macular disease. I had no friends, no one I knew with it. But anyway, and he said, when you get there, he will tell you all about it. So off I went to this other appointment and met the retina specialist, and I got sent off for more tests. And he came back and finally said, well, I've got some good news and I've got some bad news. And I said, well, what would you like first? And I said, well, I'll have the bad news first. And he said, well, it's like this. He said, you have wet macular degeneration in both eyes. And I argued the point because my right eye was fine, but apparently I'd had a major bleed on my left eye, but they had discovered with the angiogram that my right eye was just starting, and that's been great for me because now I can still see. But I didn't know anything about it. So my question to him was, what is this and how did I get it? So he explained as briefly as he could and as understandingly as he could about me and what macular disease was. And then and when I said, well, how did I get it? And he said, well, you smoke? No. You don't eat correct food? No. Well, maybe you inherited it. I said, well, I don't know anybody with it. No family member. Then he said, well, you've had too many birthdays. And I was a bit insulted about that because I was only 69 and I really didn't think I was that old. Anyway, he told me then that I would need to have the good news. And I said, well, the good news is what? And he said, well, you can have an injection in your eyes and it will help to keep your sight stable. And then I started to realise how serious this was for me. And he said, I can't do it now because by that time it was late, very late in the evening. I had to go into surgery next day to have it. But meanwhile, he gave me a folder with some information and he said, well, take this home and read it because it's from the Macular Foundation. And if you want to ask any questions, well, ring them up. And so off I went the next day and I was absolutely terrified having my first injection, but he was wonderful, talked me through it all. And now I quite gaily go off every 4 weeks and have an injection in both eyes. And luckily it's kept my sight stable. I can do all kinds of things that I may not have been able to do without these injections. So, and I'm grateful for the injections so much.
So that was a big day of mixed emotions.
Oh, it was. It was. And the date, somehow the date is riveted in my brain.
Yeah, it would be.
Yeah, so.
Thanks for sharing that, Val. We'll move on to the next question. So you did say that you noticed some waviness in the door jambs, which is what prompted the ophthalmology appointment in the first place. But when did you start noticing your vision affecting other parts of your daily life? So maybe after even the diagnosis.
Well, it was fairly gradual at first. I didn't notice a great deal, and then ever so gradually I started to realise things were getting a little bit harder to see. And one of the main things is when I look at things with different colours and the colour combinations of things on packages like food packages, boxes of food packaging, medication labels on medication, articles in magazines sometimes are all very difficult to see if they are white on a pale colour, like pale blue or lemon or pale green. And then conversely, if they are on dark colour with black writing, and I cannot see that very well at all. And that has got increasingly difficult as the years have gone by. You know, I can't sometimes read recipes in recipe books because they're made to look very attractive and the colour combinations are difficult to see. So I have to, you know, make the best I can. I'm lucky my husband will come shopping with me and help me. But that's, I had an issue at the supermarket where the screen where they check out all your prices and so on became dark green with black writing. And I said to the young man to check out, I'm sorry, I said, I can't read that. I'm an old lady with a vision issue and I can't read it. He said, well, I'm 20 and I have nothing wrong with my eyes and I can't read it either. So I saw the manager and that had been sent from head office. He said, give me 2 weeks. And in 2 weeks' time, I went back and the screen was back. It was white with black writing and I could see what they were charging me for all my groceries. And I was grateful to that supermarket manager. So, you know, I have to tell people these things because they really do affect how I live.
Absolutely. I think we talk a lot about, you know, when people use the AMSA grid, the distortions that people can experience, the trouble with reading. But as you said, the issues with colour vision is probably the most significant impact that you've noticed.
And also I have an issue sometimes with people, facial recognition with people. If they're a certain distance away from me, I can tell what they are, that they're tall or fat or skinny or fair or dark or what clothes they're wearing, but can't tell their face until they get much more up close to me. And my husband's now trained to whisper in my ear. It's if we're out together, who it is that's coming towards me, because I could, you know, not be able to see them and recognise them as you do.
So this next question is a nice lead on. So you've mentioned a few times that your husband's been really helpful, you know, to whisper in your ear when someone's coming up to you and, you know, in other aspects of your journey. But what else have you found helpful along the way?
Well, firstly, in the very beginning, when I contacted, as the specialist asked me, the Macular Foundation, and they sent me a whole list of things, little booklets and information that made me understand what macular disease was, because I'm the sort of person that, you know, I like to know what's happening. And that was why I was so upset about why it was like it was in the beginning. And I didn't know how I got it and why it came. And I'd had a lot of other issues, all sorts of health issues, and I thought I'd had enough. But, you know, the information from the MD Foundation was so good, and it made me understand what was wrong with my eye and my vision, and helped me to get on with doing what I was doing. My other thing I found, talking to other people, I've now found I know people now who have it, thanks to all the education that they've been on TV and in places. And I now understand more how they feel, and they're going through similar things to me. And each one of us is different, each one with macular disease. All our problems are slightly different, but we deal with it and we get on with it and do the best we can with adjusting our lives to how we go about what we do.
And how did you connect with some of those other people who also had macular degeneration?
I'd often chat to people in the waiting room, where you line up and wait between your tests, and discover that some of them had had it just recently, some have had it for a long time, little tricks that they got on to do help after themselves, or a lot of them had to have carers. Some had really bad vision loss, but I'm fortunate that I haven't it yet.
That's great. Thanks for sharing those, Val. Move on to the next question. So something that we've touched on, but how else have your family and friends supported you along the way?
Well, pardon me, I'm very fortunate from the very beginning. My family have been so supportive, so helpful and understanding of what's going on. My ever-patient husband has to do a lot of things for me. He takes me to my appointments and waits patiently. Sometimes it used to be for hours, but now it doesn't seem so long because I've now changed to having both eyes done on the same day, whereas I used to go on alternate weeks and that took a lot of time. My friends who, if Doug isn't available, most times he is, but if he isn't unavailable, my friends will be very kind and drive me there and wait for me and look after me, because when you come out of having the injections in both eyes, your vision's not as clear as it may be. My daughters have been helpful. One daughter decided, she realised how hard it was for me to read big print books because they were heavy, and bought me an iPad, little iPad mini, set me up with books on it. And now I borrow books from the local council library and they're free. And I love the little iPad mini that I can read the books. It's backlit. I can change the print. I can alter the size of the text so it suits me. And I have no trouble reading that at all. My younger daughter at one point went on a fun run and we lined up all her friends and they all took part as a team, and all the money they raised went to the Macular Foundation. So that was her way of supporting me. So, and even my friends, when pre-pandemic, when I used to go out to lunch occasionally with my old work colleagues, they'd always make sure I sat with my back to the glare. Val can't sit there. She will have to look at the glare. So I get looked after pretty well, you know.
That's lovely. You mentioned the iPad that your daughter gifted you. Have there been any other devices or adaptations that have been helpful?
Well, I use the iPad a lot. I have some trouble using little print on the computer. But then once again, we had lighting changed in our house. Where we had just ordinary down lights, we organised the little lights in the kitchen and in the family area where we mostly live or watch TV or whatever, to help the lighting. And it has been a great help for me to make sure that whatever I'm doing, there is good lighting to be able to see as well as I can.
So moving on now to this next question. When did you start volunteering with MDFA? And what do you enjoy about this role?
Yeah, I could probably talk for ages, but you haven't got time. But I have enjoyed everything that I have done with the Macular Foundation. I went off a few months after I was diagnosed. I was invited to one of the seminars that they organised to help inform people who have been diagnosed. And at the end of the seminar, they were asking, we are needing some volunteers to come in and work at the office. Would anyone like to volunteer? And at the time, I was only working 3 days a week. And so I decided I could find a spare day to go into there. So I started working in at the office. Well, I thoroughly enjoyed it. Was doing very ordinary things, but something that saved the staff lots and lots of time, and packaging invitations and sorting things out that they needed to have organised. But I was in with a group and I made most wonderful friends, lifelong friends, with people I worked with each Tuesday. And I used to look forward to doing that very much indeed. And in the process, I learned an awful lot about macular disease from the staff who'd all been trained in varying aspects of being diagnosed with macula. So, it was wonderful. And that was only one part of it. And then whilst I've been part of being a volunteer, I've been given so many interesting opportunities and also activities that I've been taking part in, which I would not have ever had the opportunity to do any of these things if I hadn't been diagnosed with MD. So there has to be some good thing happening about it. I've been interviewed on TV with Doug as relating to carers. And that was very new experience for me. I've been interviewed for magazines and got into magazines that friends have actually read. I've worked at expos, big expos and little expos. I've helped out at the seminars. I've even, just prior to the pandemic, got asked by one of the girls, could I go and help out at the university? And so I spoke to a room full of very intelligent looking young people with computers at the ready, all wanting to hear about someone who was living with macular degeneration. That was a bit scary for me. That was a very intimidating activity. I've even handed out kiwi fruit in Martin Place, for my main part of Sydney. That was a very interesting exercise. It was Macular Month and they were handing out kiwi fruit to people to encourage them to eat wisely and well. But when you went to hand out the little bag with the kiwi fruit and a little scoop, people thought you were approaching them for some money or something. They circumnavigate you around and about until they found out the kiwi fruit for free. And then some of them came back for seconds for them. But that was kind of fun. Well, it was, very enjoyable. But the most recent involvement I've had is on a peer-to-peer support program that was instigated through the foundation. And just prior to the pandemic, we started calling people who wanted to talk to someone who had macula. And it has continued at home now for the last 2 years or 2 years plus, where I call others. There's some very special people and who want to talk to someone who's got macula, and we discuss all kinds of things, not just our eyes, not just our vision, but how we feel. Sometimes say we have bad days and good days, and we share that with one another. And I have 10 very special people I speak to, and I'm thoroughly enjoying meeting these people on the phone. And I do it here from where I'm talking now in my dining area. And it's been very rewarding. I'm supposed to be helping them, but I kind of think they're helping me as well. So, it's very, very special for me to be able to talk and speak with these people and think, hopefully, that it's helping them cope with having this disease that we're all sharing and we're stuck with. And it's a very special program, and I hope it continues.
That's a perfect little lead on to our last question we have for you today, Val. So what would be your advice that you would give to people who have been diagnosed?
Well, first of all, I think I'd suggest that they try to stay positive. Sometimes that's a bit hard, We have good days and bad days, but just try and say, well, this is how it is, and the macula is not going to go away. But we've got to work with it. And so positive thoughts are better. And if you can deal with that, talk to someone, be positive with how you're proactive in how you're dealing with it. Look for ways to sort of do what you can't do or couldn't do, but stay as positive as you can. Look for ways to deal with it. And then the other thing, tell people that you have it. Tell people that you have macular disease, because if they don't know, they won't understand. But if they do know, I've found people are so thoughtful and caring and understanding, helping in all sorts of ways, especially with the facial recognition. Now people I know will come up and say, hi Val, it's whoever. And I don't feel embarrassed because I can't recognise them. And then last but definitely not least, if you have any queries, if you're any concerns, I've found ring up the Macular Foundation because, well, they helped me just so much during the time and have been so supportive of me. I'm sure they will be just as supportive of you as well.
Thank you so much, Val. That was some great lasting advice for everyone listening in. That pretty much wraps up our section of the interview. Really appreciate the time that you've taken to chat with me today and to share your experience and your wisdom with everyone. As always, it's lovely having the chat. So if you're happy just to stay on, maybe just mute yourself and then turn off your video. Thanks so much, Val.
Thank you very much for asking me to talk today. Thank you, Natasha.
All right, and I'll get Vicky on and we'll jump across now to the optometrist section of the webinar. Welcome, Vicky.
Hello.
So I've got a list of questions for you now. So how often should someone see an optometrist if they have been diagnosed with AMD?
Okay, I'll just preempt that with that's of me in my full COVID PPE outfit, which was fun, not fun for a year of practice. But anyway, happy to have got rid of most of that now. So as far as how often, I guess it depends, it sort of varies. I usually recommend, between every 1 to 2 years. If you have macular disease in the family, then definitely a regular check, probably once a year. If there's any signs there also, we'd like to see more regularly as well. So it depends a little bit about what's going on inside the eyes at the time. Yeah, so your optometrist will basically let you know depending on what's happening with your eyes, but at bare minimum every 2 years. But I'd probably say once a year.
So this is another question we received in. If I'm seeing an ophthalmologist to manage my AMD, do I still need to visit an optometrist? What would be your advice?
I'd say yes. So we often co-manage with ophthalmologists these days, optometrists. So there's a few different reasons the ophthalmologist may want us to monitor things in between visits. So things like your vision or, doing the AMSLA checks, things like that. It's also, I think it's easier to get in to see an optometrist as well. So if you're ever worried and we kind of know what your vision is and we know where you're at, because we've seen you recently, it's much easier to check it and be able to, refer back to the previous time we've seen you and just either put you at ease or get you in to see the ophthalmologist a little bit sooner. And I think also we probably have a little bit more time to spend with patients, so a bit more of the emotional support. If you're going through injections or if you're worried, I often get people coming in it's often just for a chat, and that's really nice to be able to offer that service to people too. And I guess the other thing, the final thing, is your glasses. I mean, I think we're going to talk a bit more about glasses, but even if you've got changes to your vision because of the macular changes that you've got, we still need to optimize things. So getting your glasses up to date as much as possible is still important.
Sounds great. Thanks, Vicky. And then the next question we have for you is, will glasses help improve my vision loss from AMD?
Yeah, so that's kind of a complicated question. So I'm going to pull in my model. I'm just basically pretending that you guys are sitting in my consultation chair. So I'm just going to run through what I usually go with. So unfortunately, it's quite old and it's lost a few pieces over the years, this thing. But so that's, there goes a lens. So that's a cross section through the eyeball. Okay, so that's it in half. So at the very front, we have the cornea. That's the iris, the colored part. Lens is in there. That's where your cataracts form in the lens. And then the retina is this surface that coats the inside of the eyeball. And as probably most of you know, the macula is the central part of the retina. So it's still your retina, but it's the very central part. So when light goes in and it's focused, it focuses on your macula. Okay. So if the retina isn't functioning properly, so if there's a problem with the macula, then it's going to affect your vision. Okay. And it will, obviously, depending on how much issues is, depends how much it will affect the vision. So glasses aren't going to improve that. If there's damage there, then the glasses aren't going to fix that. But as I mentioned before, it's all about optimizing the vision that you have got. So just checking them regularly and making sure that we're getting the light still to focus on the back of the eye will still make a big difference. It's just literally trying to optimize what you've got there. So that's, yeah, it's not going to fix the problem, but it can certainly help towards dealing with it. And I think, Val, when you were talking about the small print, well, and the difference in the contrast as well, so that's the contrast sensitivity and the color vision changes. The glasses, they're not going to help with the color side of things, but you can magnify things with glasses a little bit as well. So it's all about working on trying to make things bigger to make it easier.
It's definitely worthwhile if someone's seeing an ophthalmologist to also continue seeing an optometrist.
Yeah,
for
yeah,
those glasses checkups.
absolutely.
Okay, great. So for this next section, what would be the best way to visualize changes to the macula from what you just described?
Yeah, so I know we've spoken about AMS grids, and I'm just going to bring this one in first. It really is, it's so simple, but it is so useful. And I think anything that sort of empowers you to take charge and really to be able to self-manage this at home, monitor at home, this is the way to do it. So I'm going to explain why. So your eye is basically the size of about a ping pong ball, that sort of size. And the macula is that region at the back. It's about, you can see that. So it's about half a millimeter. It's really small. It's tiny. Okay. So Val, again, you noticed the grout on the tiles that were waving. So that's exactly what your Amsler grid's going to pick up. So, but it'll pick it up earlier. So the important thing to remember to do is to do it with one eye, and you want to do it with your reading glasses on. Okay. You'd be a bit careful if you've got multifocals, because multifocals or varifocals might make the lines distort a little bit just from the type of lens. So if you've got reading glasses, use reading glasses, and just one eye at a time. That's really important. And I'm sure most of you know how to do it. You just look at the dot in the middle, and then you're looking for any wavy lines. And I've got some slides just to show what you are looking for. But that's a way of self-monitoring at home. Just do it every now and again. The MD one, the Macular Disease Foundation, have the magnet, so you put it on your fridge. So it just gives you a little bit of ability to take control. But I'm just going to share the screen to show how we monitor the changes. Oops, I've gone to the wrong page. That's what I'm after. Okay, all right, so this is early AMD. So the image on this side is a normal, healthy looking retina. So the macula, that tiny little area that's about half a centimetre in size, 5 millimetres, is that area there. So what we start to see in the early stage of these little yellow spots, so they are called drusen, and they're basically little pockets of retina that aren't functioning properly. So they're not getting rid of the toxins, and they're sort of pooling up there in this area around the macula. So at this stage, there isn't usually much change in the vision in the early stages of AMD. So this we tend to monitor, and we'll certainly send you home with an Amsler grid to keep an eye on it at home. You can often get a lot of drusen around the rest of the retina too. We're not usually too worried about those. They just tend to be there. It's the ones around the macular area. So the next stage that it goes to is the intermediate AMD. So again, this is the reason why it's important to see you regularly. And it's also the reason why these sorts of images are really important, because again, going back to the size, and you know, the magnification is huge. We can see lots and lots of detail, and you can see that these drusen have got bigger and sort of almost fluffier looking. We used to call them soft drusen. So that's the macular area there. So we're always wanting to keep an eye on what's going on in that region. And then if we go on to so this is, again, we'll diverge. So that was the early and the intermediate phase of macular degeneration. Now we've got the dry, more advanced stage, and there's a wet, more advanced stage. So the dry one, basically, this is called atrophy, basic geographic atrophy. So this area of the retina is now no longer useful. It's basically died off. So by now your vision has really gone downhill quite a lot. And there's those atrophic changes, and you get this pigment here. So you can see quite a big difference from that healthy looking macula there. And the next one's the wet one. So this is where you just basically, there's a lot of fluid going on. That's blood underneath the retina there. So it's caused by leaky vessels that form in the surface beneath the retina, and they start to leak out fluid, and then sometimes you'll get this big hemorrhage. That's the one that really, the vision goes downhill very quickly. And yeah, things aren't looking great. The vision wouldn't be great in that eye. So that would be straight off to the doctor. As Val, you kind of experienced, that's when we want to see you straight away. So I'm just going to show you a couple of images of what an Amsler chart, the distortions that we're looking for. So we start to see these little kind of wavy lines here on this side in the earlier stages, earlier and intermediate stages there. And then it can progress to these sort of darker patches and really quite distorted lines. It just depends whereabouts in the macula that the drusen or the problems are. And the reason that you get the wavy lines is because the other way of visualizing, again, I'm pretending you're in the room with me. This is what I use at work. But I just really wanted to be able to show you this image. So this one here is a scan. It's called an OCT. And basically, we've gone from looking directly at the retina to looking at the layers of the retina. So we're looking at a cross section of the macula here, okay? So there's lots of layers, about 10 different layers within the macula. And this is a healthy macula, so it's got a nice even line, and you can see all these lines across are nice and straight and even. So what happens as the fluid builds up is you get the wet. This is an advanced wet. You can see how sort of wobbly that is, and we've lost that nice even contour. So that's the reason why your vision goes downhill a lot, because that leakage there is basically distorting and just affecting the way that the retina functions, basically. So they're the sort of two things in practice we use, is the retinal photos and the OCTs, and the Amsler grid is really the best thing that you can do at home.
Thanks for that, Vicky. And so the next question we have was, how can I slow the progression of AMD?
Yeah, so again, everyone, I don't know whether everyone's heard this over and over again, but I'm just going to keep on at it. Smoking is a huge one. There's a really, really big link between smoking and risk of macular degeneration. So it's about a 4 times higher risk in smokers than in non-smokers to developing macular degeneration. So if you are a smoker, and I know you get hit all the time from the GPs and from everyone, but it really does make a difference for your eyes. So it's something that if you're even vaguely thinking of it or wanting to give it another go, just do it. It does make a huge difference. Being active as well, we know that sort of general health and exercise is definitely good for our eyes as well, and being a little bit sun smart for sure. So there's a link between protecting your eyes. We want to protect our eyes from the UV. So I've got a picture of me, my girls and my mum. So I was lucky to go and see my mum over Easter. She lives overseas, and you can kind of spot the Aussies. I think Australians are quite good at being sun smart generally. We've all got our hats on. My mum hasn't. So I think that's also a little bit of a, you know, there's a bit of that generational, well, I haven't been doing it, so why should I do it now kind of thing going in. So, but you can see just from the photo, look, my mum's squinting away there, and you can just see from having the hat and the shadows that there's much less light going on there. We should have a pair of sunnies on. We took them off for the photo. So yeah, protecting your eyes, and then food is the biggie as well. So I think you can eat specific foods for macular health, but real food, I really believe that real food is, you know, a key to it. So the more processed foods there are, we generally know that they're not so good for us. That's not rocket science. But a sort of range of fresh fruit, different veggies, fish if you can 3 times a week is certainly beneficial. And a mix of colours, lots of different colours, and a handful of nuts. We know that there's all sorts of things in there that our eyes need and are found in high concentrations in the macula. And this isn't just sort of, oh, maybe airy-fairy stuff. There's been a lot of studies, lots of studies, huge ones over the years that have kind of, you know, built up the evidence to say that we know this is what helps protect the eyes from degeneration and basically avoiding this stuff. So the more highly processed something is, the less obviously nutritional contents in there. We don't 100% know about some of the things to avoid, but I always find this hard to say, the linoleic acids are ones, so that's actually seed oils basically. They've got lots and lots of, they've got quite a lot of linoleic acid. You know, maybe not, but probably better to avoid them just in case. And not too many refined carbohydrates, so your white bread, your white rice, the things that are good for you and the rest of your body, or bad for you and the rest of your body. It's the same for your eyes. You can go into specific foods, and I feel like I'm advertising the MD Foundation, but I honestly have been using all these resources since before I worked for these guys, and you can download this one. I really like giving this one out. So this is the nutritional one, and it's on the website, and it's got the different foods and which nutrients. So we know that lutein and zeaxanthin, for example, is found in your leafy greens, so that's your kale and the spinach. You do have to be a little bit careful if you're on warfarin. You should know that already if you're on warfarin, that you have to be careful with some foods, but that's one just be a little bit wary of. Omega-3s, we've got nuts. So it goes into the different nutrients like the zinc, and things like that. And there are options to go onto supplements as well. Usually if you're in the early stages of AMD, you can get everything you need from your food. There is some evidence to say that if you're advancing more to the intermediate phase or more, then a supplement might be beneficial for you. That way you're guaranteed to get everything that you need in there. I think that was it for food. And yes, so I'll stop sharing.
They were great tips on how you can slow the progression of AMD. And for that booklet that you're mentioning, Vicky, if anyone would like to order the nutrition fact sheet, we'll be sending out a post-webinar survey where you can fill in a request to receive any of our resources. So then moving on then to some of the treatment for the wet type that you were talking about before, what actually are the injections doing for AMD?
Okay, so basically the injections, you could see, if you remember, actually I might go back to that slide, is that okay? Oops. Get rid of all the food. Oh, that's my cauliflower as well. I snuck one of my, I'm trying to practice what I preach. So I roasted some cauliflower last week and it was delicious. Anyway, here we go. So basically the purpose of the injection, so the reason you get the fluid underneath the retina in the first place is because for whatever reason, the eye is producing this stuff called VEGF. It's a protein. And basically it stimulates these new blood vessels to grow. The new blood, that's called a neovascular membrane. So sometimes we call it neovascular AMD as well, wet neovascular. It's the same thing if someone's talking about it. So these new blood vessels that grow, they don't tend to be very well formed, so they can basically leak. And so once you get that leakage there, the whole purpose of the injection, it's called an anti-VEGF injection, is that it goes in and it's basically drying up that wet area in the retina, and it's trying to basically stabilize the vision, because if that leakage stays there, then the vision just keeps getting worse and worse and worse. So treatment, I think it was a bit over 15 years ago that they first started the VEGF injections, that they came around, and I always find it amazing that they came out of a bowel cancer drug, that someone had that thought to try it in the eye. Obviously it's a bit more involved than that, but yeah, so before I was practicing before the VEGF injections came out, and it was horrible. It really was. You know, there was a couple of therapies that were around, but they really didn't do anything, and they actually would make your vision worse to try and stop it getting even worse. So yeah, the injections that have come about are really important, and keeping on with them is really important too, because if you stop it, then basically the fluid will just return.
And Val can definitely attest to that, as you know, been receiving injections since 2009, and still the vision's, you know, mostly being quite stable. So they're definitely a great treatment to halt it as much as we can. So what would be we only probably have time for one or two more questions. We're 5 minutes out from the end. So what would be the longest time between injections, Vicky? And will someone have to keep receiving injections indefinitely?
Yeah, okay. So at the moment, there's it's usually between 4 and 8 weeks between injections. It depends on which formula you're receiving. There's 2 in Australia. And it depends on how your eye responds as well. So there's lots of different factors. The interesting thing though is that we are seeing some new treatments coming out. They're not out yet, so they're still in the sort of final trial phases and waiting for any kind of FDA or TGA approval. It's hoping that once they hit the ground, they could be up to 4 months between injections. So that's going to be a really big, you know, game changer. It's just going to obviously ease the burden of having, going from monthly to potentially 3 to 4 monthly will be really good. But yeah, you do need to keep on at them. At this stage where we're at, the injections are what we've got, and it's really important to keep on at them. I know we're running out of time, but really quickly, just part of the research, I'm looking at research quite regularly, and there's been lots of studies that have come out since COVID and lockdowns, and the impact that lockdowns have had on treatment schedules, and obviously they've been delayed in a lot of cases, and it has negatively impacted on quite a lot of people's vision. So it just shows us that it's important to keep it up.
Great. I'll just quickly condense this last question that we have, just to squeeze it in. This person's written in saying that they have wet AMD and have been receiving injections in both eyes for some time. They've then had a bleed and lost significant vision. But since then, they've had some improvement in the vision, despite the fact that they've had the bleed. So how likely is it that they will return to full vision in that eye?
Yeah, I mean, it's difficult to know the answer to that, I think, for anyone to answer it. Obviously, the goal is to see how, continuing with the treatment, how much drier that macula will get, so that if there's a good response and a quick response and the macula dries out quickly, then there's a good chance that the vision will keep improving. It just depends on the location and how much fluid is in there, basically. So without knowing all the details, it's hard to answer that one.
I think that's all we might have time for today. So thanks, Vicky. That's been really helpful, especially having those slides to refer back to.
Oh, sorry. Stop sharing.
Oh, no, that's fine. I'll just quickly just jump on to just finish up. As always, we just like to mention some of the other work that MDFA is involved in. So ultimately, the goal is to reduce the incidence and impact of macular disease. We have the prevention and early detection pillar, which looks at awareness campaigns and just bringing people's attention to macular degeneration. That definitely includes those kiwi fruits that Val was handing out as a part of an old campaign that we would have run with the volunteers. So Val's been an active member in a lot of those awareness campaigns, but there's a lot of different work that we're doing in that space. The supports and services we run, including the education sessions, the webinars, the telehealth service that we run through the helpline. This all encompasses the support and services that we offer. The advocacy work, which is a big part of the work that Vicky does in the team here at Macular Disease Foundation, is advocating for making sure that Medicare rebates aren't cut and other issues that are affecting the macular disease community. And finally, the research and data that we run. We have a research grants program that funds Australian research, where we're looking at new treatments or new ways to support people with macular disease. Our toll-free helpline number is on the screen, 1800 111 709. So you can connect with us by calling this number. We also have an education email, education@mdfoundation.com.au. So any follow-up questions, please feel free to type out an email if you prefer rather than calling. And any of those resources that Vicky mentioned, the AMSA grid, the nutrition fact sheet, you will also be able to find on our website, mdfoundation.com.au. As I mentioned before, we have a post-webinar survey, so we'd appreciate any feedback that you can provide about today's webinar. You'll also have access to previous webinars, and you'll be able to be invited to future webinars that we'll be holding. And a last little plug for the next webinar coming up. The title is Understanding and Living Optimally with Vision Loss for those living with vision loss, their families and friends. That will be on Wednesday, the 1st of June at 2 to 3 p.m. Australian Eastern Standard Time, and will be presented by Cameron Algie. So it's a nifty little link there. If you want to scan that QR code, that will take you straight to the registry link. So we'll finish up there. Thank you both so much, Val and Vicky, for sharing your wisdom, your experience. I really appreciate the time you've both taken to come on today. Thank you.
Thanks, Natasha.
All right, thanks everyone for joining us. Bye.